First interaction with the Productive Ward was in the context of being a director in the Southeast, where we had some interaction with the NHSI in relation to the international fellowship scheme that they run, or the fellowship scheme that they run. It's now international. And we were toying with the idea of sponsoring somebody in the area of improvement to come in our little region and do some improvement work. And that improvement work was centered around the Productive Ward. So this fellow would go to the UK, learn a little bit about improvement and improvement science and some of the detail in relation to metrics, and come and introduce a Productive Ward in one southeast corner of Ireland. But then it all went horribly wrong and it became nationalised when somebody overheard in the corridor what I was trying to do. So we started a national project. The second thing we did was we actually looked and said, well, we have a great opportunity here in Ireland to learn from the implementation in the UK and to take the best out of the implementation in the UK and try and put a model in place in Ireland that would learn from either the mistakes and the successes of some of the sites in the UK. And that led us to step 3, which is really to design a robust implementation plan that was nationalised and systematic, and that wasn't sporadic, and we wouldn't have islands of improvement, that we'd actually have a systematic approach to implementation. And in order to do this on a macro level, in December 2010, January 2011, we started up a national advisory group, because we realised that some of the evidence coming from the UK was that sometimes this thing created a little bit of an IR stir, that when you mentioned lean it meant cutting jobs. So we engaged the national nursing unions in a national advisory group, and they helped set up the National Implementation Group, which are the doers. So the advisory group were the thinkers, and that's thinkers, not tinkers. And the National Implementation Group are the doers. Some of the good stuff that we took from the executive guide is the importance of the project improvement facilitator. So most of the steering groups have a very senior member of staff who's a fixer, who's a doer. And so if the wards are coming into issues in relation to requisitions going down and not being listened to, or if they're looking for money to sponsor or to organise training, that there's a fixer. And we've just had our second lot of our phase 2 sites who have gone through the readiness audit and started their module implementation in December, and have just started the project work now. And we now have 11 new wards and 7 new sites in phase 2.